Happy Monday, Michigan. I'm Justin Hicks, public health reporter here at MLive, and today we're joined by Michigan's Chief Medical Executive, Dr. Natasha Bagdasarian, to discuss where Michigan stands with COVID-19 as we head into the first couple days of March and determine where we go from here. So welcome, Dr. B.
Thanks for having me on today.
Absolutely. So let's dive right in. A few weeks ago, the state health department announced it was withdrawing its public health advisory on masking in indoor settings, which had been put in place back in November. At the same time, the state started to refer to this three-phase COVID cycle. And that's kind of where I wanted to start today. Can you walk us through the three phases and explain what life will look like in Michigan when we're in each one of those phases?
Yeah, happy to talk about this. I think this is a really useful communication tool. I'm going to make my screen a little bit bigger so that I can actually see it on the screen. I think this is a really useful communication tool to have at this point. We know that we're in a different phase of the pandemic than we were a year ago or 2 years ago. And it really calls for us to think about the virus a little bit differently and think about the pandemic differently. And this cycle is one way of showing how we're looking at this differently. There's a lot of discussion in the press and in national media about moving from pandemic to endemic. And a lot of people are making it sound like it's a straight line and that things are just going to get better and then we won't think about COVID anymore. And that's not really what we're anticipating when we talk about public health and our public health response. What we're actually anticipating is COVID-19 is going to be with us. It's not going anywhere. It's not done with us. But what we are expecting to see are more predictable surges of COVID. So COVID is going to go from something that's been very unpredictable, where we haven't really had a good sense about what's coming next, to something that's more predictable and that acts more like another viral respiratory syndrome that happens in the wintertime, for example. And what we're talking about is being able to signal to the public when things are higher risk, but also when things are lower risk. And we just finished what we're calling a response phase or a surge, and we're moving into this lower risk time. So I'll just take you through it really quickly. The response or surge means that we saw a lot of cases. Our hospitals were overwhelmed. We were in a pretty dire public health situation. We were really looking at, could our hospitals handle more cases? What can we do to ease things on our infrastructure? And the response phase was all hands on deck. It meant putting out whatever tools we have and making them available to the public. So we had increased supplies for testing going out. We have strong language around masking. We used all of our therapeutics and moved those out into pharmacies and hospitals to try to get those used. And it was really this all hands on deck scenario. After the surge, we're entering into a relatively lower risk time. So we're entering in what we're calling recovery. And recovery is a time really for the public to be able to catch their breath. It's a time where we can dial down some of the mitigation measures that we had been using, but it doesn't mean that we are completely done with COVID or we're forgetting about the pandemic or that we're not in a pandemic. We are still very much in a pandemic. But during this recovery phase, things aren't quite as dire as they were during the surge. And what it really means is from the public health standpoint, we need to watch conditions and watch to see what is on the horizon. And for the public, this is a time to think about some long-term planning. So long-term, are you and your family ready for the next surge? Is your family fully vaccinated? Are you thinking about how to keep your family safe during the next surge? And it also doesn't mean completely throwing away all the mitigation strategies now. It just means that we can tone them down a little bit. The readiness phase is a phase where we see something on the horizon that's coming and we signal to the public, get ready. Get ready because we are expecting a variant of concern or we're expecting another surge of cases in the wintertime. And really, it means that we start that really strong messaging again. And I think this is an important tool for us because we can't expect the public to live at this really high anxiety phase forever. I think we have to be able to signal that this is a slightly lower risk time. And then hopefully when we're signaling that it's a riskier time, people will listen to us and engage with us.
Okay. I know one of the points that came out right when we were introduced to this three-phase cycle was the idea of masking and the specific advisory for masking indoors. Can you walk through when we're in these phases? Is there a phase where masking indoors is important when you go to the grocery store, the gym, wherever? And I mean, us being in a recovery phase, is that less important now? What does masking look like in these phases?
Okay, so first, that's an excellent question. First, I'd like to go through what our actual masking guidance is right now. So again, it's not saying that we want you to throw away your masks or that we don't want you to mask. It's that really broad statement that we had. So in November, we issued this public health advisory that said not only do we want the public to mask in indoor public settings, but we want all of these businesses and all these settings to have mask policies. So it was really broad, sweeping advice. And what we're saying now is we still want you to mask if you are in isolation or quarantine. So isolation is if you have COVID and there's specific advice around that. Quarantine is if you've been exposed to COVID. So we still think that there are some times when you should really mask for the safety of others. We don't want you to spread COVID. We also recommend masking in congregate settings. So that means long-term healthcare, hospitals, correctional facilities, those types of settings. We still think masking is important. And then if you are going into a setting that has a local or federal mask policy, we still want you to follow those policies. So there could be schools, businesses, local health departments, and then federal transportation where there are still mask policies. And we think it's a good idea to follow those mask policies. Now, also, the flip side of this is that if you don't fall into those categories, you may still feel more comfortable if you wear a mask. And I think it's really important that we support people's choices to wear a mask if they so choose. So even though that really strong public health advisory is gone, there may be folks who want to wear a mask for a variety of reasons. And some of those reasons could be that they are more vulnerable. So if you are more vulnerable because you have a medical condition that puts you at higher risk of complications, if you have a family member or someone in your inner circle who is more vulnerable, you may choose to continue masking. If you are going into a setting where you feel the risk of exposure might be high, so say you're going to a concert or going to a place where you think there may be a lot of people who are unvaccinated, maybe you want to continue masking in those situations. If you yourself are unvaccinated for whatever reason, and if you simply feel more comfortable wearing a mask in certain settings, we want people to feel comfortable making that choice for themselves. So what we're doing is we're removing that really strong statement that we had, but I think that there are still a lot of reasons why individuals might still want to make that choice for themselves and for their family members.
And so going into the idea of these three phases of this cycle, would it then be safe to say that masking, while there maybe it's higher recommendation when you're in that surge, that there really isn't a phase where the guidance is don't wear a mask?
Well, as we go through these phases, I think the guidance and the recommendations are going to change. So what a readiness phase looks like this year might be very different than next year. And what a response or a surge looks like this year might be different next year. So right now, during this recovery phase, we still have some masking recommendations about masking in congregate settings, for example. I don't necessarily expect those to last forever. So I would say that the situation is going to evolve as, number one, we are faced with new and different challenges. So COVID is always ready to give us a new challenge, and we're always seeing new variants of concern that may have different characteristics. But then we're also gaining tools along the way. We have oral antivirals now that we didn't have just a few months ago. So as we gain new tools, the guidance could also change. As COVID changes, the guidance could change. So I don't really think that we want to tie specific guidance to all of these phases, because I think that the situation is going to change as time goes on. But in general, recovery means we can dial things down. Readiness means prepare, and response means dial things up.
And the idea of us being in recovery post-surge now, Are there data points, thresholds that we're looking at? How do we know that we are in a post-surge recovery right now?
So I think a lot of this really means we have to look at the big picture in a very holistic way. It's not simply about metrics anymore. And I think the early days of the response, we were tying specific behaviors to specific metrics. With the 3 phases, we're really talking about more of a predictive view of things, more of a predictive long-term modeling view of things, and anticipating when things are going to happen rather than just waiting for the numbers to shoot up and then reacting. So it's more proactive than reactive. And what we would base the cycle, the places that we're on in the cycle is on a few things. So number one, the CDC has new community level metrics. And so that takes into account numbers of cases as well as burden on healthcare. And so we would be looking at the metrics, but again, not necessarily tying things just to the metrics, right? So right now, when we look at the CDC map, much of the state is at green. So much of the state is at low transmission, and there are still a fair number of counties at medium and very few counties at high. So most of it is green. And we're also talking about being in this recovery phase. So the recovery is not tied to being in this green phase. What the recovery is really tied to is the fact that cases are dropping very fast. The fact that more than half of our residents in Michigan are now vaccinated. So that's some amount of protection. The fact that there's also some natural immunity based on how many people just recently got over Omicron and Delta variant infections. And then the fact that we have these tools. So we're looking at this picture very holistically. It's the metrics along with the other factors that go into this. When we decide to move from recovery to readiness, the goal would be not to just wait until the metrics change. So not to just wait until we're in high, but to actually look forward and say, well, there's a variant that we're really worried about. And that variant isn't in the US yet, but we think it's coming soon. Or that variant isn't in Michigan yet, but we think it's coming soon. Or looking at other things that are happening across the country. Last year, what we saw was in Michigan, we saw cases really spike when schools reopened. And that had happened in states in the South a little bit before us. So looking at what's happening at states where their schools have already reopened might give us a clue as to what's going to happen when our schools reopen. And then also we've got this weather factor, and we know that SARS-CoV-2, the virus that causes COVID-19, it likes cold, dry weather. And respiratory viruses generally transmit better in the wintertime. There's also more transmission when people are gathering indoors. So also preparing for a surge next winter is probably a good idea. So those are the types of factors that we're looking at when we talk about moving from recovery into readiness. And then the response phase, again, we want to be proactive. We want to really start getting all of our tools and all of our messaging out there before things get too bad. We had a little bit of practice this time around with Omicron. So Omicron allowed us to do some predictive modeling. We looked at what was happening elsewhere in the world, elsewhere in the country. We put some modeling together, and our modeling was pretty accurate. It showed us when we would see a surge, how long it would last, how high it would peak. And many of those predictions were fairly accurate. So we'd like to keep doing that and being really proactive, preemptive, and having that early communication with the public.
You talked about that idea of modeling and how accurate those models were for, I think the last time we talked about models, it was January. The models predicted that late January, early February, we were going to see this pretty high spike, and then it was going to kind of fall off a cliff as we headed into and through February. And that is what we saw. What are models telling us we can look forward to in the spring and the summer right now?
So I think the reason the models were so accurate before was because we had this very specific variant that we could, that modelers, and we didn't do this internally, we used some national modeling tools, but modelers were able to look at this very specific variant and see how it was acting in other parts of the world, and then use Michigan's data. What are our vaccination levels? What's the weather like? put all of those factors together and see what our surge would probably look like. Now, I think that it's a little bit more difficult to see the future now, looking into late summer, early fall, because we don't know if there's going to be another variant of concern. So when there's a specific situation that we're concerned about, that I think is the time that modeling can be most helpful. And otherwise, what we're doing is, I'm calling it horizon scanning, where we are just aware and alert for things that could impact Michigan. So I'm watching very closely what other variants are doing in other parts of the world. I'm looking at other changing situations, looking at data on vaccine efficacy and what do we think vaccine efficacy looks like after a year or 2 years. So all of those pieces go into this horizon scanning part and really looking for future threats to Michigan.
Okay. We got a question about folks who, both children who are unable to get vaccinated yet and folks who have children in their family who are unable to get vaccinated. What's the guidance on masking for those folks who have kids that are younger than 5 at home? And then do we have any outlook on when those younger kids are going to be able to get vaccinated?
So I think that in general, our guidance for individuals who are either unvaccinated themselves or who have family members who are unvaccinated is, you need to look at your specific situation and what we're terming your risk budget. So I think that for a lot of folks who have younger kids, they may want to consider whether they participate or don't participate in activities that could be higher risk. So for example, going into a big crowded indoor arena, maybe that's something that they would want to avoid right now. They may also choose to base their masking around the risk to people around them who are unvaccinated, or if they themselves are unvaccinated. Again, it has become more of a personal choice rather than something that is a statewide recommendation outside of those specific congregate settings, quarantine and isolation settings. And it really depends. So when I say risk budget, what I mean is everyone has a different amount of risk that they're willing to take. So for some people, they really don't want to take any risks, and it's safer to avoid certain activities, or if they're going to go into certain settings, they would want to wear a mask. And I think that's perfectly reasonable. I think there are other families that have a slightly different risk budget. They're willing to take more risk because, for example, they feel that this is a great time to show this understanding personal and household risk. There may be families who are willing to take a little bit more risk to do activities and things that they deem very beneficial to their family. And I think everybody's decision-making process is a little bit different. But this particular graphic allows you to see how you can sort of tailor some of your risk budget and how you decide to make your decisions, whether it's to avoid certain activities or to wear a well-fitting, high-quality mask in some of these situations.
You talk about the idea of well-fitting quality mask. I know in the early days of the pandemic, and even maybe the first year or so, there were folks wearing cloth masks. There were surgical masks, N95s and KN95s. Those type of respirator masks were harder to find, but some people still wore them. Nowadays, it seems like there's maybe a greater push towards those N95s. What do we know about quality of masks, and are there certain masks that we don't advise wearing anymore that maybe we kind of had to back in the early days?
Well, any mask is better than no mask, especially when you're talking about risk to others. So a lot of what we were doing in the beginning was what we call source control. And that is, if everyone wears a lower quality mask, you're still putting less droplets out. And so it's protective to those around you if everyone wears a cloth mask, for example. We know that if you wear a mask that's well-fitting, and by well-fitting, I mean it adheres to the sides of your face and doesn't have gaps around it, and something that is high quality, meaning that it filters out small particles, and that has to do with how many layers it has. So if you're wearing a well-fitting, high quality mask, that also then becomes protective to the wearer. And so what we find is that Cloth masks, which are not regulated, those it's hard to tell because some may be well-fitting, some may have multiple layers. So those are a little bit of an unknown. Then we've got the surgical masks, and those tend to be good in terms of layers. They're multi-layered, but many of them have gaps on the side. And so those gaps on the side mean that they're not well-fitting unless you're taking steps to make them better fitting. And the CDC has some great graphics on how to do that. You can do things like tying knots at the side, or wearing a mask fitter that sort of adheres it to your face. And then we've got things like KN95s or N95s, which are both well-fitting. They adhere, they don't have gaps, and they're multi-layered. And those offer the best protection to the individual. And that's one of the reasons why public health experts around the country are moving away from everybody needs to mask in indoor settings to individuals who are vulnerable or who are concerned about their risk can continue to mask for their own protection. It's because of the availability of well-fitting, high-quality masks that offer greater protection to the individual. So it sounds a little bit funny that we would be less strongly recommending masking to everyone because we have the availability of these really excellent masks. But it's because we're now thinking about them as being protective to the individual rather than something that's just stopping droplets from getting out into the air around you.
Okay. I want to go back to one of the things you mentioned earlier, the number of counties and areas throughout Michigan who are in that green, that lower transmission. In recent months, we've seen kind of a shift from you go to the drive-through testing site, you go somewhere, you wait a couple of days to get your test results back. We've seen kind of a shift from away from that. That's still available to folks, but there's more at-home self-administered testing available. I know that the federal government's made them free and available to get your first 4, and now they're going to send out another 4 if you're interested. And just the availability of those at-home tests are greater now. Are we worried at all that we can't accurately gauge COVID transmission rates, case rates, knowing that less people are going to get tested at those sites that report back to the state versus those who just test at home and maybe those results never get anywhere?
No, I think it's okay. I think it's okay for where we are in the pandemic. And we really want to encourage people to test at home. We really think that those at-home tests are a valuable part of our tools because they allow people to test whenever they feel it's necessary. So if they've been exposed, if they have some mild symptoms, it's a lot easier to test at home than to go to a testing site somewhere and make an appointment or wait in lines. Or just travel out of your house. It's just much more convenient to have that available to you in your home. The reason why I don't think that this is a bad thing is because the metrics are also very different. They mean something different than they did a year ago or 2 years ago. And what I mean by that is it's not just about number of cases anymore. So in the early days, it was very much about number of cases because we simply didn't have tools. We didn't have vaccines, we didn't have therapeutics. And so there was no way to prevent a mild case of COVID from turning into a severe case or even death. Now that we have those tools, it's not just about number of cases anymore. What we're trying to prevent is not every single case of COVID. We're trying to prevent severe cases. We're trying to stop people from dying. And the best way to reduce your risk of severe complications, severe disease and death, hospitalization, being on a ventilator, all those things are vaccines. Vaccines offer the best chance of reducing your risk of severe outcomes. And then our therapeutics also offer great benefit in terms of reducing your risk of severe outcomes and death. And so using those two things together, the risk of people progressing on to severe outcomes is much lower than it was in the early days of the pandemic. And those other two, so we've got on this graphic here, we've got vaccines and treatment, which are in the dark blue. So those reduce your risk of severe consequences. And then we've got tools like testing, so over-the-counter testing, having those tests available really rapidly and whenever you want it, that means we have earlier detection. and then you can get treated and you can stop transmission earlier. And then, of course, mask, distancing, ventilation, we know that those things work as well in terms of reducing spread. But the reason why I'm not worried about catching every single case of COVID is because the trends are still telling. So we still know if cases are going up or cases are coming down. We're keeping a close eye on what's happening with our hospital capacity, because that's something that we desperately need to maintain, is our hospital capacity and making sure that our hospitals can take care of people when they're unwell. But the absolute number of cases is not the most important thing anymore. If we could get more people vaccinated, we would, again, significantly reduce the risk of severe outcomes and death.
So it sounds like testing is important in terms of, am I infectious? Am I going to maybe pass COVID on to people around me? More so than it's important to get your tally put into the system so we know how many COVID cases are reported in Michigan on Monday, March 7th, 2022.
Yeah. And Justin, we're really moving into a place now where we're trying to give Michigan residents tools to take care of themselves. So one of the other changes is that if you have COVID, you may not necessarily be contacted by someone who's doing case investigation and contact tracing. We want to start advising the public, this is how you notify your close contacts. This is how you isolate. This is what we would like you to do at home. There was a lot of COVID out there when we had that Omicron surge, and we simply couldn't keep up with all of those cases. But also, as we move into this new phase of the pandemic, if we can give Michiganders the tools they need to keep themselves safe, then we don't need to do everything in this very top-down, heavy-handed public health calling you and asking you where you've been. We can simply tell people, this is what we want you to do to keep others safe. This is how to contact all of the people who've been around you when you were infectious. This is what to tell them. This is how to seek treatment. And it puts that, the control a little bit back in the hands of Michigan residents to take care of themselves, which is typically what we do in public health. Our role is to try to support individuals in making the best choices and doing the things to keep themselves safe. And I think most people want to do the right thing. We just need to get the messages out there and get the tools out there.
We got a reader question here. I want to know, what would need to happen to require masking if another surge like Omicron were to happen? So what would we need to see, if there's anything, for a masking requirement, a masking mandate to come back into play?
So one of the things that we've seen with COVID is that it is always able to surprise us. We are always, we have to be ready for situations that we haven't seen before. So just to say broadly, we don't know what the next surge will bring. We don't know if it will be if it'll be something milder. We don't know if it'll be something that threatens to overwhelm our healthcare systems. We don't know if the next variant of concern will be something that evades vaccines, or if it is much more transmissible. So I think it's very hard to say, this is what we would look for in order to do X, Y, or Z. I think that we have to be able to pivot. We have to follow the science and data. We have to be able to look ahead, look at future variants that come our way, and say, how would we deal with this specific problem? And that's what we aim to do.
And you mentioned the idea of a variant that maybe dodges vaccines more. If we got to a point where we had a new variant that the vaccines were not as effective for, or treatments we have or testing we have would not be as effective, does that open the door for a possible mask mandate to come back? Is that the type of scenario we would be talking about?
I think it's really difficult, again, to be able to lay out a situation like that. So for example, one of the things that we saw with Omicron is we saw some of our available therapeutics became less effective or not effective. The monoclonal antibodies that we had been using through the pandemic, we had monoclonal antibodies that we could no longer use. And right around that time, pharmaceutical companies came up with monoclonal antibodies that could be used, and oral antiviral pills. So as we lose tools, sometimes we gain other tools. And we would really need to see what the exact scenario was. So it's very hard for me to answer a hypothetical question like that, other than I think that we at the state are continuing to look forward and we will respond to situations as they arise.
Okay. What do we know about this Omicron BA.2 variant that is maybe coming up in headlines lately? And does it have a chance? Do we think it has a chance to bring another surge to Michigan, or do we know if it's already here? What does that look like?
It's already been detected in Michigan. So we are doing sequencing. We have a very robust sequencing program, and we do a lot of sequencing, but that doesn't mean that we're sequencing even close to all of the samples in the state. And so we've been following it, and we have a handful of cases. It does not seem to be taking over the original Omicron strain, but we'll continue to watch it. And if there is a situation or a variant of concern that we think is going to change the epidemiology transmission, that's going to cause an impact on Michigan, that's when we would start messaging out that, hey, we're in readiness, and this is a situation of concern. We're not there at this moment.
Okay. We talked about earlier about this three-phase cycle as kind of a way to look at the pandemic moving forward. What type of life duration do we expect that cycle to have? Is that something that we carry through 2022? Do we think it's a multi-year, or is this kind of a forever thing of we're in one of these three phases at all times?
What I would anticipate, Justin, and I can't predict the future, but what I would anticipate is going through this cycle a few times. And what I'm anticipating is that recovery becomes longer and longer and less intrusive, and recovery eventually becomes the place where we sort of live, and it becomes less onerous, and recovery is simply a time where we're looking ahead for what could be coming next. I don't think that we are going to either eradicate or eliminate SARS-CoV-2 anytime soon. However, there are many other viral respiratory illnesses that we live with that cause surges in the wintertime, like influenza. And so we just have to be prepared to go through this cycle a few times. Again, I'm hoping that our response becomes less anxiety provoking and less able to interfere with our lives. And I hope that recovery becomes somewhere where it becomes more comfortable to live here. And again, it's less intrusive with our lives. And then eventually recovery becomes something that the public isn't thinking about, but that we in public health are thinking about, so that we are continuing to do the horizon scanning, and you don't have to have these conversations with us, hearing about what's coming next. We're simply doing the work behind the scenes.
MISC, what did we see with the Omicron variant when it comes to MISC cases? And maybe you can touch on very basically what MISC is, and what type of follow-up are we using for these cases?
So MISC is basically a syndrome where it's an inflammatory syndrome that we're predominantly seeing in children. It is still quite rare, but it can happen after infection with COVID. And what we saw with Omicron is not just with MISC, but just pediatric hospitalizations for COVID. We saw those go up. And that was very concerning. And a lot of that has to do with our vaccination rates. So when we look at our vaccination rates, sorry, Justin, I'm taking us a little bit off topic, but when we look at our vaccination rates, what we see is we did phenomenally in vaccinating our over 65 population. And then vaccination drops with each decade until we have the lowest vaccination rates in our 5 to 11-year-olds. And with Omicron, vaccination for 5 to 11-year-olds was still pretty new. So it was a largely unvaccinated population. And again, that puts children at risk for severe complications like MISC. And one of the things that we need to do when we're thinking about being in recovery, but we're thinking about future surges and future readiness, is we have to really think as a society, how do we get our vaccination rates up in children? Because we don't know what the next variant is going to look like. Is it going to be something that causes more negative effects in children? So again, great vaccination rates in over 65s, and that's why we don't see the type of death that we saw early on in the pandemic. So those who are the most vulnerable overall are well vaccinated, but children are still at risk. Children still get negative consequences. And we need to do something about vaccination in our 5 to 11-year-olds, in our 12 to 18-year-olds, in our 18 to 30-year-olds. So each decade, our vaccination rates are lower and lower. And if we want to protect our children and young people, we really need to get them vaccinated before the next surge.
Where do we stand on getting a vaccine for those folks 5 and under?
So we're still waiting for a little bit more data. And what we're hearing is maybe by May, we'll hear something.
And you mentioned the idea of even that next group up, the 5 to 11s and 5 even into the teens, are the rates are not where we want to see them. What's being done to try to get folks to get their kids vaccinated, to maybe make them more comfortable when it comes to the idea of getting their kids vaccinated?
So we've been talking to pediatric groups around the state on how to best talk and communicate with their parents, because it's parents who are the ones who are making this decision. And then what we're also seeing is there are differences in terms of vaccine uptake by geographic location around the state. So a lot of this has to do with where you live. And then we also see differences amongst racial and ethnic groups. And so there are lower vaccination rates in African Americans at the moment. And that concerns me because then it leaves certain populations more vulnerable. So what we're seeing right now are low vaccination rates. For example, this is not the only group, but in 5 to 11-year-olds who live in Detroit who are African American. And that worries me because when we see another surge, and I'm saying when, not if, because I think we will not see rates just stay at this low level forever. When we see another surge, that is a group that is not as protected. And so we're doing as much outreach as we can. We're talking to trusted messengers in different communities. We're working with Detroit Public Schools to get vaccination into some school facilities, administered by school nurses who are, again, trusted messengers. But it's something that we really need to tackle as a state and as a society.
We kind of started with this question, so I want to come back to it. The idea of, is COVID still a threat in Michigan?
Yes. So the pandemic is not over. The pandemic isn't over. And even when we are at low risk levels, that doesn't mean that that there are not people who are being hospitalized with COVID. It doesn't mean that there are not people who are still dying from COVID. So COVID is still a risk. The pandemic is not over. But I think that unless we are able to communicate with the public, not just when things are dire and high risk, but we also have to be able to communicate that things are relatively lower risk, because one of the things that's really important is having public trust and having the public believe in the words we're saying, and not being completely out of touch with what's happening, in communities. And people are tired of this pandemic. People are tired of having restrictions and limitations and not being able to be with their loved ones. And so what I wanted to do was to be able to communicate that this is a time of relatively lower risk. And if you've been putting things off, if you want to see your family and friends in safe ways, taking precautions, this is a relatively lower risk time to do that. And I'm hoping that by communicating that this is a lower risk time, that when we say we're moving to readiness and when we say we're in a response, that people also believe us and take those public health recommendations seriously.
If there's kind of a one takeaway you want folks to have from this chat, what stands out, or what do you want them to come away with?
I think the one takeaway is, like I just said, the pandemic isn't over. We are still very much in a pandemic. We are not forgetting about the public. We are not saying throw away your masks. What we're saying is that those really, really strong recommendations that we had issued in November, saying our hospital systems are under strain, things are really bad in our state right now, we took those down because we are in a better place right now. Most of the state is in green or yellow when you look at the CDC map. So we are in a better place, but the pandemic isn't over. We will see surges again. I do want people to be able to have a little bit of a breather and maybe resume some of their normal activities, but with the understanding that things could get bad again. And if you want to continue wearing a mask, don't feel like you have to stop. I think this is really a time where we need to come together as a state and say, you know what, we support each other. There are people out there who are vulnerable. So if you see someone wearing a mask, you don't know what their decision making is, you don't know what their reasons are for wearing a mask, but be kind. Let's just be kind to each other. And then let's prepare for the future. And the best way to prepare is by getting vaccinated.